Welcome to Sexy in Your 60s. This is a space for women 50 and beyond who are choosing to live with vitality, intention, and joy in this chapter of life and the ones ahead of us. I'm your host, Dvora Citron, registered nurse, National Board Certified Health and Wellbeing Coach, and Plant Strong advocate. On this podcast, we explore what truly helps women thrive in midlife and beyond through evidence-based health insights, real stories, practical strategies, and the deeper sense of meaning that makes life feel rich and connected. I intentionally chose the title, Sexy in Your 60s. When I use the word sexy, I'm not talking about sexuality or how we're seen. I'm talking about energy, confidence, presence, curiosity, purpose. Sexy is how you feel in your body. Sexy is how you move through the world. Sexy is knowing who you are and choosing how you want to show up. I believe this stage of life isn't about winding down. It's about waking up. Not in your 60s? You're still invited to join us. Each episode is designed to support you not just in how you live, but in how you feel in your body, your relationships, and your life. I'm so glad you're here. Let's begin. Midlife can feel like a strange contradiction. On the outside, we're often more confident, capable, and clear than ever. And yet, inside our bodies, things are shifting in ways we weren't always prepared for or even told to expect. Today's conversation is about what women over 50 actually need when it comes to their health. Not rushed answers, not blanket assumptions, and not being told to simply accept discomfort as the price of aging. I'm joined by Cheruba Prabakar, a board-certified OB-GYN and fellowship-trained minimally invasive surgeon who specializes in caring for women through midlife and beyond. She brings a perspective grounded in deep clinical expertise and years of listening closely to women's real concerns, including the ones that often go unspoken. In this conversation, we talk about what truly changes for women after 50, what many women aren't thinking about yet, how long gynecologic care really matters, how sexual health fits into overall well-being, and what it actually means for women to thrive, not just medically, but in their bodies and their lives. This is a conversation about aging with intention, clarity, and self-trust. Dr. Prabakar, thank you for being here today.
Thank you so much for having me, Dvora. I'm so excited for this conversation. I loved everything you said in the intro about living with purpose and intention.
We share a lot of the same values.
Yes.
Dr. Prabakar, I'd love to start with the science. In the last few years, what shift in research or guidelines has most influenced how you're approaching care for women in midlife and beyond?
Yes, that's a great question. When I first finished training almost 15 years ago, the focus at that time when we thought about women's health was really in the reproductive ages, getting pregnant, having babies, and all of that. Now, the focus has shifted to midlife and beyond, and rightfully so. I think, contrary to popular belief, this is the age group where we need to spend more time with to make sure women feel confident and are well taken care of. There are so many things that can come up in these decades that will determine the quality of life for many women as they age. Most notably, of course, menopause hormone therapy has a front and center stage over the last few years. I think this is a great advancement and development, and I would say redevelopment over the years. We're seeing that has a lot of promise for many, many women in midlife.
I'm just thinking about the fact that when you divided us as women into those who are childbearing and menopause and beyond, for menopause and beyond, what we have going for us right now is that we get so many decades to look forward to. It really does make so much sense to focus on that side of the population, right? So
Yes. I have
So,
many women who tell me, I'm already done having kids. I don't need to see a gynecologist or I don't need anything else. I'm already done. And I'm like, no, no, no. This is when the real work begins.
mhm. One of the dilemmas in medical care for women in midlife and beyond is deciding whether or not you should continue to see your gynecologist or whether you should centralize all your care with your primary care physician. Can you talk to how long women should continue to see a gynecologist and what role their gynecologist plays in their medical care at this stage of their life?
Yes, that is such an important question. And I really believe that you should see a gynecologist for life. Let's face it, a lot of primary care doctors are not doing breast exams, are not doing pelvic exams, or maybe they'll do the breast exam, but they're not doing the PAP. And you can hardly blame them. They have 15 minutes where they have to scrunch in so much information about your whole health that this portion is often sent off to the gynecologist. And I think honestly, rightfully so. We have a lot more experience with pelvic exams, being able to detect subtle differences, subtle abnormalities. We deal with so much more than just a breast exam and a pelvic exam. What I tell women is there are so many other things that are happening in midlife and beyond: urinary incontinence, urgency, frequency, maybe prolapse issues, and of course, hormone therapy and all the menopausal changes that come with that. Painful sex can be one. I've also picked up vulvar cancers, melanomas on the vulva. No one's looking down there, and your primary care certainly isn't. It's super, super important to see a gynecologist every single year. We do stop PAPs at 65, but that does not mean that just stop going to see the gynecologist. The majority of the work that we do in a women's lifespan really starts at that midlife and beyond.
I would like you to repeat that one more time. I think that is a landmark statement.
Yes, the majority of care that we provide for women starts at midlife and beyond. My youngest patient is 10, my oldest is 97. I see everybody in between. I also deliver babies here and there. When you're young, you're overall healthy. You're often not having all of these issues, and you give birth, and that's all great. You're seeing the GYN often. But after that is when so much begins, starting from cystocele, the bladder falling down, rectal problems, again, prolapse issues, urinary symptoms. I just saw a patient this week who said she's been having urinary incontinence for the past 20 years since after the birth of her baby. The women who say, oh, yeah, I'm done having kids and I'm going to stop seeing the gynecologist. Well, who's really diving deep into these other issues? And this can affect the quality of life for many, many women. Women should really see their gynecologist for life every year for as long as they live. When I said most of our care happens midlife and beyond, I really, really mean it. You really deserve a specialist to really take care of you. It's super important that someone is your quarterback.
One of the things that you do as a gynecologist is you discuss other specialties and how important it is to follow up. It's no secret that you are my gynecologist, and you reminded me that I need to go get a colonoscopy, that it's not really okay to just rely on the little mail-in tests. I did that. Thank you very much. When you look at women in their 50s and 60s, what do you think they are not thinking about that matters for their health and quality of life as they are hopefully aging in a healthy way?
Many women believe that things that are happening in their body are just normal. They may be part of getting older, but you don't have to think of it as normal and something just to deal with. It's super sad to me when women say that, oh, yeah, I'm peeing my pants every day, but I just thought that this was part of getting older. Or, oh, yeah, my husband and I don't have sex anymore, but I guess we're in our 60s. And I'm like, no, 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 we don't just give that up like that and say, oh, this is it, you know? Or my vaginal skin is super dry, but yeah, this is part of getting old. I actually really hate that statement when patients tell me that. I would love for women to feel and believe that there is more, that these are the best years of their lives. They're not bleeding post-menopause. They don't have to worry about pregnancy and having to use all this birth control, and they can really embrace these years and have a very, very fulfilling life. That's the message that I try to give to my patients.
You're talking about a shift in mindset based on science, because we know that that's true, that we get to look forward to decades more of healthy, high quality lifestyle. But we do need the medical care to help us with that. And we need the science about how to stay healthy. And I know that's something that you don't just give your patients advice about, but you embody it in your own life yourself and set a great example. I know that you are a very good listener. In medicine, it's not just about looking for signs and symptoms, it's about noticing what's underneath. How do you listen for what your patients aren't saying when you're caring for women 50 and over?
Ooh, that's a good one. Yes. I think the one of the biggest problems in medicine right now is the time factor. When many women go to the gynecologist, and again, even today in 2026, going to the GYN often in many systems equates breast exam and pap test. So you're out of there in 4 minutes, right? Because there's just no time. There's no time to listen to what you did for vacation and your life and, things like that. But when you do have that time, patients will tell you things that are happening, like, oh my goodness, I shrunk 2 inches. Immediately, I'm thinking, ding, 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 do they have osteoporosis, right? Patients are talking about their social life and the fact that every time they have a drink, they get hot flashes. Then we dive into the conversation about healthy living and the 6 pillars of lifestyle medicine and how to reduce alcohol. So time, I would say, is the number one asset that most physicians don't have and most patients are not privy to. It doesn't have to be the case. There are physicians out there who do give you time. As patients just tell me about their stories, some of it has nothing to do with medicine. That's really when I can pick up, well, what is really important to this patient? Is it important that they play golf? Is it important that they go swimming? If their estrogen patch is falling off, well, maybe I have to try something other than the patch to still allow them to have their hormone therapy and go swimming. It's all of these things that I just pick up as they're talking, and I give them the opportunity to talk, which is rare.
Storytelling is so important. You are listening to the stories because that's where meaning comes from when we express ourselves. And that's how we learn. You're able to pick up the nuances when your patients are sharing their life with you because you
Absolutely.
have the opportunity in the type of practice that you have to give them the time to do that. What about when you don't hear them talking about something that you think you need to know about, but they're not comfortable asking? Can you talk about that?
Yeah. Yeah, there's a lot of studies that show that patients won't bring up things necessarily, like especially things that are maybe a little embarrassing, like low libido, painful sex, or even urinary frequency or incontinence. Many women just kind of brush that under the rug. They're embarrassed to even talk about it. So I just make it a point to always ask all of my patients those questions because the studies also show that when a doctor actually brings it up, patients are more than willing to talk about it, but they're not going to bring it up the first time. I create that rapport where, hey, you're the GYN. I'm here to help you. Anything goes. That's my pattern and routine. And then I get patients talking about it. But had I not asked, they would have never brought it up.
There's also the people who tell you, oh, you're just getting older and that's the way it is, sweetheart. One of the mind shifts that's important to make when you're looking at the decades you have left and how you want to live them is not just looking at what problems do I have and how do I want to fix them, but how can I age in a healthy way? Do you see a difference in supporting healthy aging women and trying to fix women in midlife?
Yes, that's how we should all be approaching our health. We may have pre-diabetes that's going to eventually get to diabetes, but if you know you have a family history, well, you should really start working on that in your 20s, right? You don't want to wait till you get that. Same thing with osteopenia or osteoporosis. Yes, we may have a family history, but there are certainly things that you can start doing early on to push that out a little bit. I'm talking to my patients about all of these things right in their 20s, even college age kids. Sometimes I'm thinking, they're probably like, oh my gosh, what is she talking to me about all this stuff for? But nope, nope, nope. You get all that if you come here because a little seed that I plant, I'm hoping that even younger women will realize that at some point. It's never too early to start talking about these things. As you said, you don't want to wait for something to happen and just put a band-aid or now just treat it. We want to provide, as they say in pediatrics, anticipatory guidance for the things that we all know we're gonna, experience at some point. If we can be prepared for it, and if we can do things that are going to ease our transition around that, then, that's a win.
I'm the school nurse who would always talk about the uncomfortable things like preventing sexual transmitted infections and contraception. People were like this all the time. Oh, I don't need to know that. I know you don't think you need to know it right now, but when you do need to know it, you'll appreciate the fact that you have already
Yes.
heard about it. So, what do you talk about at your dinner table? Now that I've shifted my focus into the population of women age 50 and above, at the dinner table, I talk about topical vaginal estrogen and why everybody's supposed to be using that, because by the time you have those problems, it's already kind of too late, right?
Yes, exactly. I think there's also a mindset shift in many women who have less of a tolerance for these kinds of issues and they want to get ahead of it. I mean, I just had a patient today whose bone density was just zero point 0.1 off into the osteopenia range. And I said, look, it's only zero point 0.1. You're doing all the things. Let's reevaluate that. I don't think you need to start going on all these medications. But she was so proactive. She was like, well, even if it's zero point 0.1, is there anything I can do? Maybe I just want to have a conversation about it. And I said, absolutely. But which is very different than maybe 10 years ago or even 5 years ago when women would be like, oh, okay, fine, we'll just recheck it in 3 years. So I think there's a cultural mindset shift as well in women now, which I love, where women feel like, yeah, I want to stay ahead of it.
I'm at the end of the boomers, and I've definitely heard that. You just described the difference between the two generations pretty well. And the boomers have been, of course, at the mercy of all the Women's Health Study Initiative consequences. And the Gen Xers are being like, I want to be on top of this. I'm not going to wait for something to happen. I'm going to make sure my life is the way I want it to be, which is a terrific perspective and mindset. So,
Absolutely.
from your perspective, when you're working with women 50 and above and you're supporting them in their definite, deliberate efforts to really thrive, what do you encourage them to do medically and beyond medically?
I was joking with a patient that once you hit 40, your self-care list becomes like a laundry list. Before it used to be just go to the doctor once a year, maybe go to the eye doctor once a year, see the GYN. Okay, maybe you have a few appointments. Now it's like, okay, yoga and Pilates and weights and meditation and mindfulness. I mean, the list goes on and on. But really, that's what's necessary. It's way more than just your physical health. I think your social connections, your mental health, all of this plays in. And this is the time when these things start to fall apart, where we're often sending kids to college, maybe taking care of aging parents. People are sometimes moving places. They have to set up a whole new social situation. They have work and then they have their own physical ailments. So it's a very complex interplay of many different areas of life that are intersecting. For my patients who are really 40 and beyond, I talk about, well, how are you doing with all of these other things? Not just like, okay, hit the weights for bone preservation and muscle. Are you doing stretching? Which again, nobody really talks that much about it, but it's so, so essential. And I think that kind of work helps with balance. So maybe you will, prevent yourself from tripping somewhere and then having a fracture. I really try to emphasize this 360 type of view for your health. It's just not physical things that you can measure in a test or a lab, but it's your emotional health, it's your mental health, and your social connections, which is, I believe, just huge, huge, huge in terms of, your overall health.
Your care is very holistic, and I know it's based on lifestyle medicine. And you even mentioned the 6 pillars of lifestyle medicine. That's unusual to see these days because most medical care is very siloed. You go to one specialist, this specialist, the other. And even though all my doctors have electronic healthcare records. They're on different systems. And so it's hard to get them to talk to each other. So it's very refreshing to have a doctor who really has a holistic, like you said, 360-degree perspective and understands that when someone comes in your office, you're not really just addressing their gynecologic health, you're addressing their total health and how,
Yes.
from a gynecologic lens.
Absolutely. I made a social media reel recently of the many roles I play, and I said one of them was a gynecologist, right? Because so many patients, I mean, I had a patient today. Of course, she had one GYN issue that could have been taken care of in 10 minutes, but she had so much more to tell me about her life and her relationship and all of these things. And I had the time to listen. But for her, feeling well meant being able to give me all of those other details that some way did connect to her GYN health. But I was able to really pick out where she needed my support. I think, as you talked about, stories are where it's all at. And when people share their stories, you pick up a lot.
Mm-hmm. Let's pivot. I'm sure people ask you this all the time. Dr. Prabakar, I'm 50 and above. What are the top things I need to be concerned about? Screenings or medications? Just give me a quick
Yes.
list.
Yes, okay. Definitely see your primary care doctor every year and a gynecologist every year. You should be doing a colonoscopy, at 45 every 10 years. Your PAP is every 3 to 5 years, and your mammogram every single year. That's what I would say. In terms of screening, the second thing is I really, really believe that the majority of our health is affected by what we eat. And I know you, Dvora, also believe that and have your whole Slant to Plants channel. I really, really spend a lot of time talking about this because whether it's abnormal bleeding or menopause, or endometriosis, fibroids, whatever it is, everything is affected by what you eat. I strongly suggest a plant-based diet plus fish, seafood if you want, but just a very, very healthy diet is number two. Number three is movement. I think weights are critical 2 to 3 times a week. Cardio, of course, and also the flexibility piece, stretching, Pilates, yoga is really, really critical. The other thing I say is out of all these three, just pick a couple of things and make sure you do them consistently. I see many women going all in, they do all these things for 1 year and then they've completely fallen off the bandwagon and they don't do any of it. They're back to eating poorly, they're not exercising. Whatever it is, just being consistent is going to be very, very key. Also, it should be sustainable. I see a lot of data about the protein intake now, 120 grams, 130 grams. For many women, this is just me on my soapbox. I think it's unsustainable, and I don't even think you need that much protein. But making sure that you really have a balanced diet and that it's something that you can put into practice every single day despite your busy life is going to be critical. Lastly, you don't need to do a ton of supplements. I often see patients with a whole list. Vitamin D and B12 are my favorites. If you're actually lifting, creatine is also great. You really don't need much more than that.
Thank you. I love and agree with everything you just said. I think it's true. One of the biggest challenges right now when you're in the space of women's healthcare and menopause and longevity is how much misinformation or information that's misinterpreted is out there and how people really love to follow fads all the time. Like you said, they just come and go. Even if they're good practices, as a health coach, one of the things we do is we bridge that gap between the great solid information and medical advice and helping figure out how to sustainably build that into somebody's lifestyle so it becomes a part of who they are. It becomes part of their identity.
Absolutely, yes. Once it becomes that, then it's hard to go away, and then you can build on that. These basics that I just mentioned should just really be a part of everybody's life. It's time we stop giving excuses and saying, "Oh my gosh, I was so busy and the holidays and all of these things," because you and I both know that you can actually thrive through all those busy times if you have these practices in place, not the other way around.
Just one more plug for the healthy food because everybody that knows me knows this about me. I just love the way I eat so much. I get so much enjoyment out of it. People are worried about being deprived if they do something that's healthy for them, but really you can just find so much joy in it. Same with exercise and every healthy thing that you just mentioned. So, Dr. Prabakar, I always ask this question at the end of the interview. When you think about women in midlife at their healthiest and most grounded, what does sexy mean to you?
Yes. Sexy means, when I think about women who are in their 60s, or if I just fast forward and think of myself when I'm 60, and if I say, wow, I'm sexy, I would love to not have any surprises with my health because I've already been putting in the work over the last 20, 30 years in terms of managing the typical risk factors that present in women: heart disease, diabetes, cholesterol. I would not want any surprises. I would want to exercise without pain. I would want all my joints to be working well and be able to lift weights and run without peeing on myself, right? That's what I would consider. I would want to be able to sleep well, 8 hours a night where I get uninterrupted sleep and I wake up feeling refreshed. I would also say feeling sexy for me would also mean having really good friendships and not being siloed just in my house or my job where I don't have those meaningful social connections, because that really plays into my health as well.
Thank you so much. If listeners want to connect with you, can you give us some information about how they can do that? And I will also put information in the show notes.
I'm on social media across all channels: TikTok, Instagram, and YouTube as TheFibroidDoc. So you can find me there. And our practice website is www.lamorindagyn.com.
Thank you so much. One of the things that stays with me from this conversation is how much midlife health isn't about doing more, but about paying attention differently, asking better questions, not dismissing what feels off, about giving ourselves permission to expect care that supports the whole person, not just a checklist. If there's one takeaway I hope you hold on to, it's this. Thriving in your 50s, 60s, and beyond isn't about chasing youth. It's about feeling at home in your body and supported in this season of life. Thank you for being here, Dr. Prabakar. Thank you, listeners, for listening and for staying curious about what this chapter can hold.
Great. Thank you so much for having me.
Thank you so much for spending this time with us. If today's conversation resonated with you, I invite you to take the next gentle step by downloading the Sexy in Your 60s Starter Guide, a free resource designed to help you reflect on what supports your energy, vitality, and sense of connection in this season of life. You'll find it linked in the show notes or at slant2plants.com/starter-guide. You can also explore more of my work, including health coaching, plant-forward nutrition, and resources for vibrant living at slant2plants.com. And for the ultimate transformation, join the Sexy in Your 60s coaching experience at sexyinyour60s.com. If this episode spoke to you, please consider following the podcast, leaving a review, or sharing it with someone who might need it right now. That's how these conversations continue to grow. Until next time, take care of yourself, stay curious, and stay boldly, beautifully sexy, exactly as you are.